Hello. Hello. So let us continue with Alan's keynote's study streak. And good evening, Dr. Manikanta Konkala. And sorry, it was difficult to pronounce your name because I've not pronounced it earlier. And it was, sometimes Instagram IDs are very much concise, like Boger Synoptic Key. So we are discussing Nash therapeutics study streak, and lot of remedies we have discussed so far, almost more than 50, 60, 70 remedies. And today the remedy that we'll discuss is hepar sulf. Now this is also again another remedy which is mentioned in uh, you know 3 or 4 or 5 pages. And since it is a huge remedy, we need to take it one remedy at a time. So let us take up this remedy. The first thing what Dr. Nash tells us, and that is about how this remedy is somewhere in between calcarea carb and sulfur. One side there is calcarea carb, one side there is sulfur. So it gives you an idea of how you should see this remedy. Sometimes you will be wondering whether this case is of calcarea carb. Sometimes you will wonder whether this case is of sulfur, and you will be confused whether to give this or that. That is where this sentence comes of use for practical purpose, which is that this remedy stands between calcarea carb and sulfur. This is what the first line of Nash therapeutics study streak by Dr. Eugene Nash tells us all about this remedy. All right, so what further does Dr. Nash tell us about this remedy? The very first thing, and that is a very important thing, and that is extreme sensitiveness. So we know that hepar sulf is a remedy which is close to sorinum. Some factor which is very important in sorinum and hepar sulf, and that is the extreme sensitiveness to cold. But hepar sulf is a step further, and we see that in hepar sulf the extreme sensitiveness is for touch, for pain, for cold air. So all the cases that we see, it cannot just be respiratory cases, it can be any other case which has aggravation or extreme sensitiveness towards touch, pain, or cold air should fall in the domain or should fall in the prescription for hepar sulf. So much is the extreme sensitiveness that hepar sulf would probably faint due to pain. This is what Dr. Nash tells in the further lines. And eruptions cannot be touched. That is another level of sensitiveness. Or even if the air is blowing on it, it gets aggravated. So we all know in winter season we are prescribing remedies like sorinum, petroleum, And other miserium is one of the remedies we prescribe for aggravation by cold air, or getting ailments from cold air in terms of skin cases. But Hepar sulf is also one of the remedies we should give a thought, because it has extreme sensitiveness on the skin as well. So it's not just the respiratory organs, it's not just the throat complaints or the mucous membranes which are affected, but entirely the entire body is affected by extreme sensitiveness, especially by cold air and by touch also. So next, Dr. Nash compares Heparsil with China officinalis. So if you have been prescribing China officinalis, or if you would prescribe China officinalis in future, you will know how this remedy is another also similar remedy for extreme sensitiveness, especially to touch. Now, in China, it is better by strong pressures. Aggravation by slight touch is there, but better by strong pressure. So, if you have this modality of extreme sensitiveness to touch, you can check whether the opposite, which is the deep pressure amelioration, is there. And if it is there, then you can definitely consider China officinalis to prescribe. If it is not there, then Hepar sulf can be given a thought, along with, of course, another remedy which is Kalikar. So eruptions cannot be touched, aggravated by air blowing on cold, cold air blowing on that part, and similar other remedies which have extreme cold sensitiveness. Dr. Nash mentions arsenic album, calcarea, then Nux vomica, sorinum, silica, and tuberculinum. So all these remedies are kind of cognates, or you can see that they have this common modality in aggravation from air or cold air, or extreme sensitiveness to cold air. Now, this sensitiveness, Dr. Nash begins in the first paragraph and goes on to explain the sensitiveness, and he comes to a word which is very important, which is super sensitiveness. So, we will have some patients who would be telling us that I just cannot, go through the cold air, or if there is a cold air which blows through in certain weather, I just cannot tolerate and I need to cover up, otherwise I get cold and cough. That is the super sensitiveness of Hepar sulf. And then Dr. Nash gives us something which is valuable in terms of suppurative stages of local inflammations. Now you will have throat complaints which will have suppurations, you will have abscesses which will have suppurations, you will have some deeper inflammations which will have some suppuration. When to give heparin in high, when to give in low. When the pus has formed, suppose it's a case of abscess and the pus is about to form, it has not yet formed, and you will see that high potency is given and it is not repeated too often, then you can prevent suppuration and check the whole inflammatory process. So all homeopaths, you are wondering when to give which remedy, how to give this remedy, that remedy, etc., etc. But what is interesting is that if the pus is about to form and the pus has formed, that is the differentiation we need to learn. If you learn this and when to give which potency, that is another challenge for homeopath. Your job to prescribe remedies in different cases with confidence becomes easier. So Hepar sulf is a remedy you will be giving when pus is about to form. In high potency you should give, and if it is not repeated too often. So high potency for normal beginner homeopath would be 1 m, but for someone who is like 5 7 10 years into the practice, for him the high potency would be 10 m, 50 m, and cm. So if you want to kind of abort the entire suppuration inflammatory process, it can be throat, it can be abscess, think of the very high potencies 50 m, cm, and do not repeat too often. It will abort the entire uh, process of inflammation. If there is formation of pus already, you can see that there is lot of swelling, lot of uh, you know the abscess is formed already, there is a different color, and you are giving high potency, but it will hasten the uh, you know ulcer or discharge. So what you should do is you should give it in low potency at that time. So this is the differentiation what Dr. Nash gives us for these two potencies or these two categories of prescription. And then he gives us a case of large glandular swelling, which where he gave Hepar sulf CM potency. Now, for a normal many of the cases what you see in Dr. Nash's book, either he has given 30 or 200, or he has given extremely high potency, which is CM or MM or DM, or Finke's certain 55 mm potency, etc., etc. To get the confidence to prescribe at these potencies, number one thing you need to do is you need to have the peculiar symptom, which is very striking and there is nothing else in the case available. Number two, the the case taking has to be perfect. You can't be careless in case taking. You need to be good observer, and you need to rule out the other remedies for prescribing one remedy in high potency. This is one of the lacunae of a homeopath, and it comes by practice, no doubt. But once you develop that practice, see different patients with different homeopaths, online, offline, wherever you can, and you will definitely get to know when to prescribe higher remedies. Slight injury suppurates. We all know Hepar sulf is one of the top remedies for slight injury suppurates, and Hepar, along with graphitis and Merck sol, will help in such cases. Chronic catarrh, nose is stopped every time, and whenever patient is exposed to cold air. So we know that hypersensitiveness is there, extreme sensitiveness is there, super sensitiveness is there. These are the different words used by Dr. Nash. And if there is slightest exposure to cold air and the nose gets stopped, the first remedy that should strike your mind is Hepar sulf. Another remedy that is given by Dr. Nash in comparison is tuberculinum, and Hepar sulf mostly will be better in warm room. So if you are wondering that only two remedies are there for this condition, it's not as such. There are another couple of remedies also. If you go to Kent repertory in the cough chapter, you will see least exposure of hand from the covers, and exposing to the air gives rise to cough. There are only four or five remedies: Hepar, Aconite, Baritacab, and Rustox. So this is how you learn materia. You go to repertory, confirm, you come back and read in materia which author has given which remedy, and how you overcome the lacunae of repertory, lacunae of materia, and bridge between the gap that you need to understand. So Hepar sulf is one of the remedies which has this kind of a nose which gets stopped up when the patient is getting exposed to cold air immediately. Cough as if the mucus would come up, but it does not come up. This remedy comes of use after aconite or spongia. So you will be wondering when to give aconite, when to give spongia, when to give this kind of Hepar sulf as a prescription. But what is interesting is that you should know the inflammatory process. You should keep in mind the pathology which is going on in the background. If it is first few hours and redness or rubor, calor, dollar, what we come up with those terms in pathology study, if those phases are there or just the primitive symptoms are there, aconite will help, spongia will help. But if the stage has proceeded further and it is about to get localized, or the chest seems to have pleural rub, or there is cough which is rattling. This is what Dr. Nash tells: cough which is accompanied by wheezing and rattling. So there is no accumulation as such like antimtart or like other deeper remedies like Lycopodium calicum, but there is kind of a struggle between the upper and the respiratory tracts. That is where Hepar sulf can come in of good use. Early morning hour cough, Hepar sulf is going to help a lot. All the patients, asthmatic patients, especially at night, first half of the night, Aurelia Rasmussa. Second half of the night, you can think of ammonium carb, kali carb, or third half of the night, or early morning hours, Hepar sulf, again ammonia, or you can think of other peculiar remedies like natrum sulf also. So Dr. Nash tells us that for Hepar sulf, the exudation of the mucous membranes is not specifically contained in the mucous membranes, but it is also in the other parts, especially like the skin diseases, where after desquamation we can think of hepatic. Now, all those cases of psoriasis which have desquamation, or the skin has kind of peeled off and it's become very sensitive to air, give hepatic extremely high potency, and you will see that the next time the crop appears will be better, and it will not go to that stage and it will abort itself. And also after acute inflammatory stages that have been controlled by conite, hepatic is a remedy that we should think of. In chronic asthma, Dr. Nash tells us that Hepar sulf resembles natrum sulf. Now, we most of the homeopaths get prejudiced with certain remedies, and they think that this remedy will not work in some conditions, or this remedy will not work in that condition. So we would probably be wondering, whether we should give heparin in asthmatic condition. There should be deeper medicine, but Dr. Nash gives us a very good resemblance of in cases of chronic asthma with natrum sulf for hepar sulf. And what he compares is that hepar sulf is aggravated by dry cold weather, whereas it is better by damp weather. Plus 3 marks, it's so significant. It is better, it is the only remedy he tells which is better in damp weather. So all the patients who are asthmatic and they feel better in damp weather, they should be given hepar sulf. But if they are aggravated by damp weather, natrum sulf is one of the remedies that can serve as an intercurrent, or it can help totally, and better by dry cold. So good to see our regular homeopath colleague, Dr. Chandrasekhar, to join us, and he has been following since a long time all the workshops, most of the lives he attends, and this is the dedication we need from all the homeopaths to master the basic stuff and keep on renewing it again and again, again and again, because the moment you revise it second time, third time, fourth time, it kind of gives you the power to become a master of it, and that is what mastery is all about. So let's go to hepar sulf, which Dr. Nash has described so beautifully in around 5 to 6 pages. And for Hepar sulf, he tells about asthma comparison with natrum sulf. We discussed about it, and he tells us that cough is aggravated when any part of the body is uncovered, which is very normal. We discussed this a few minutes ago in the particular rubric of Kent. Also, you will find 4 remedies, and two of them are given over here. Baraitakav and Rustox are the two remedies, and this is the ailment from in all the complaints. So we must be thinking that cough or respiratory troubles are the only places where hepar sulf is aggravated or where hepar sulf should be indicated. But uncovering of the body is a phenomena for hepar sulf throughout, whether it is in skin, whether it is in bone pains, rheumatic complaints, or respiratory complaints. All the places wherever you see, that is what Bonington's analogy is all about. So if you want to again go and revise Bonington, his analogy, his way of working, you should consider the particular modality affecting a part as a whole, or consider it as a whole to affect the person. Then you will unlock many of your cases. And suppression of skin eruptions for hepar, again, it is one of the very top remedies. In throat complaints, Dr. Nash tells us that first there will be splinter like pain, someone is poking within, and then there will be an actual sensation of fish bone. Argentum nitricum, dolichos, and nitric acid are the three remedies which Dr. Nash tells us are very strongly with this symptom, along with hepar sulf. And Dr. Nash then goes on to compare all the throat complaints of belladonna, hepar, Merck, Merck sol, in fact, and Merck protoiodide, and lacasis, laccan, and lyco. And he tells us how one remedies are different from the other. They are very basic modalities, and this is all what you need to differentiate in clinical acute cases. You do not need to go and develop some new theory, get some new rubric, or analyze a case from different method in acute cases and in acute manifestations, you need basic modalities and you have very less data available. So if you know these little things like belladonna right side aggravated by touch, Merck sol excess salivation, Merck protoiodide beginning in the right going to the left, lachesis left side, leccan alternating side or alternating time in one morning and another time of the evening, and lycopodium right side and better by warmth. These are the very basic things what Dr. Nash gives. Most of your patients will fall in this, few remedies for throat complaints, for pharyngitis. Go for these remedies if you want good success, and Heparsil for the extreme sensitiveness and splinter-like complaints. And if there is a patient who has a chronic problem, like for example, we discussed chronic asthma, he compared with natrum sulf. Over here, he gives an example of chronic conditions of hepar sulf, which are with the hardness of hearing, which we will mostly see. And in GI tract, for example, there will be longing for acid things. Now, what are acid things? You will see that patients will usually want pickles, or patient will usually want some, very much acidic foods. All these things, they will be accompanied in cases of chronic dyspepsia or marasmus of children, and they will be accompanied by sour diarrhea like mac carb and calcarea carb. So it's very rare to give Heparsal for gastric complaints, especially when they have certain cravings. But Dr. Nash gives us with confidence these lines that it can be indicated in children who are emaciated and those who keep longing for acid things. It can be lime, it can be pickles, it can be some acidic foods. And it is similar to mac carb and calcarea carb in these respects. So whenever you think of mac carb and calcarea carb in gastric imbalances, give a thought to Hepar self. That is going to help you. Next, he gives that along with the diarrhea, there is an opposite condition also in Hepar self, which is atony of rectum and bladder. So it can be stoppage or it can be irregularity. For example, in urination, there is a feeling that he needs to wait before passing urine and he never finishes the urination. It always seems to remain in the bladder, and the drops will be kind of dribbling and not in a continuous flow. Alumina, silica, and veratrum album can be the remedies for such cases, along with Hepar sulf. And last but not the least, he compares with Mercsol, Hepar sulf in cases of rheumatism, quinsy, or boils, the concomitant symptom being that there is lot of sweating, which is a great sweat remedy. This is what Dr. Nash describes Hepar sulf to be. So that's all from me right now from Homeo Setu. You can follow us on WhatsApp channel, Instagram, Threads, Facebook, YouTube, everywhere, X also, and some interesting study like we have been doing so far will be all the time be available for all the homeopaths, and let's revive classical homeopathy and bring it back to its deserved status. So that's all from me right now, and thank you all for joining and hope it is helping you all. So thank you, Dr. Chandrasekhar, and also those who are attending on Facebook and Instagram. We are live simultaneously in all the three places. So see you all tomorrow again for the next Nash Therapeutics study streak.